Sugar. It's like the best, and it's the worst. Let me explain. Hi, this is Dr. Michael Berglund. Welcome to Common Sense Medicine. Today we're going to tackle the subject of diabetes. We're going to try to help you figure out, can your diabetes be reversed or cured even? First of all, we have to decide, what is diabetes? Well, there's two different kinds of diabetes. There's type 1 diabetes and there's type 2 diabetes. They also call the first one is juvenile onset diabetes or insulin-dependent diabetes mellitus, okay? And by the way, I threw in mellitus because there's a diabetes insipidus also. And diabetes mellitus deals with blood sugar, and diabetes insipidus deals with like a kidney problem. So we're going to deal with something called diabetes mellitus. There's type 1, which we're not going to talk about, which is the insulin dependent. And then there's type 2, which is also called adult onset or also called non-insulin dependent diabetes mellitus. So before we get into the disease, let's talk about how the body deals with blood sugar. This is obviously candy. It's probably made with high fructose corn syrup, and it is very sticky, all right? So that's one of the features of candy. It's also very sweet, right? And so those are the things that our body does. Now, how does your body process this? Well, this happens to also have some gelatin in it, but let's just pretend this is all sugar, okay? So this is all sugar, and when I take this in my mouth, my body automatically senses the sweet, right? And starts to figure this out. How am I going to process this? There's going to be a flurry of sugar being absorbed, okay? Then my body has to break this down. Now, if it's fructose, it'll absorb the fructose straight through. If it's sucrose, it has to use an enzyme called sucrase to break it into a fructose and a glucose molecule. Glucose, okay, is the fuel the body runs on. The body needs glucose to make ATP, which is an energy source which the body needs to function. Without glucose, we fail to function. When the body has too high a level of blood sugar in the system, at that point, you're diagnosed with diabetes mellitus. Well, how's my body supposed to function? Okay, so here's what happens. Your body takes in sugar, absorbs sugar. Once the body sees a certain spike in the sugar, an increased level in the sugar, or a fast rise in sugar, the body releases insulin. Now, insulin is basically the key that the blood sugar uses to get into cells. Without insulin, sugar can't get into cells. Sugar can't be stored as fat. Without it, none of that stuff happens. We have blood sugar, okay, and we have insulin, and the insulin then goes to the cell, insulin's a hormone, it tells the cell, let me in, opens the door, shoves the sugar in. So what we depend on, what this whole thing depends on, is this key and lock sequence, right? That this insulin floating around the system can connect with this receptor on all the cells in the body and can let the sugar in. The problem with diabetes, type 2 diabetes, is there becomes an insulin resistance, okay? And what happens is that key mechanism, that connection no longer works as well as used to. So now it takes 2, 3, 4 insulins to come up and finally let its sugar in. Sugar gets stuck in your bloodstream, okay? The sugar can't get out of your bloodstream. And once it gets in there, it has a hard time getting out. Is there a way to reverse this? Absolutely. Now, that means we say goodbye to a lot of foods that we love. So you avoid foods that eventually make glucose. So those foods are all the sugary products, all the sweet drinks, a lot of the starchy foods, almost all grains, corn, potatoes, a lot of these, and rice even. All these foods tend to eventually form into sugar. People go, what else is there to eat? I'm like, well, there's meat, there's fruit, as long as you're not going crazy on fruit, and vegetables. And to a certain degree, some people handle legumes well, some people handle nuts well, and seeds. These are all perfectly fine foods to eat and perfectly fine foods to live off of. If you have diabetes mellitus type 2, type 1, sugar is a poison to you. You need to understand that. The sooner you understand it, the better you'll be able to live with it. One of the big things that reasons why people have insulin resistance is when they're overweight, when they carry too much weight. That will cause a lot of insulin resistance. So one of the options is really to start losing weight, start exercising, and eating properly, eating the right amount of calories. And I know I've thrown you for a loop probably today, and told you things that you think are almost impossible to do, but I know you can do it. And I believe in you. And don't find your answers in medicines only. Try and solve this from your food and your diet, and I think you'll be happy. This is Dr. Michael Berglund, and I thank you for stopping at Common Sense Medicine.